Understanding Health Anxiety, a comprehensive overview. Hello, I'm Dr., a psychiatrist dedicated to creating educational content on mental health. Today, I want to talk about health anxiety, a condition that blends characteristics from two disorders recognized in the DSM-5, somatic symptom disorder and illness anxiety disorder. In earlier editions of the DSM, this condition was known as hypochondriasis, from which the stigmatizing label hypochondriac emerged. Health anxiety is characterized by persistent and excessive worry about one's health. People with this condition often obsess over normal bodily functions such as breathing or heartbeats, as well as minor physical imperfections like skin blemishes or common discomforts including headaches, stomachaches, or feelings of lightheadedness. What makes health anxiety particularly distressing is the tendency to catastrophize, interpreting even the mildest of symptoms as signs of severe, life-threatening illnesses. How health anxiety manifests. An individual experiencing health anxiety might, for example, feel slightly nauseous after 2 consecutive meals and conclude that it must be an early sign of stomach cancer. Minor symptoms are not taken at face value but are instead magnified and misinterpreted. There's also a tendency to overanalyze bodily sensations, linking them directly to specific diseases. For instance, a person may feel heart palpitations, a common symptom of anxiety, but instead believe they are experiencing a serious cardiac condition. This belief often leads to repeated medical consultations. Even after receiving a clean bill of health, individuals with health anxiety may doubt the results and become convinced that something critical has been overlooked. As a result, they frequently seek second, third, or even more medical opinions, and may undergo unnecessary diagnostic tests. This cycle reflects a deep-seated distrust in the medical system, alongside the belief that the concern is not being taken seriously. Common misconceptions in health anxiety. People with health anxiety often hold several core misconceptions about their symptoms and the healthcare system. Here are 6 common examples. My anxiety symptoms will escalate and kill me in my sleep. Even after accepting that their dizziness or chest tightness might be due to anxiety rather than heart disease, some still believe that anxiety symptoms can escalate to life-threatening levels. Normal test results mean the illness is undetectable. Instead of being reassured, they may believe the tests simply aren't sensitive enough to detect the illness they are convinced they have. A clean bill of health today doesn't mean I won't be sick tomorrow. This belief is rooted in the idea that an illness could be silently developing and will eventually reveal itself, despite current evidence to the contrary. Doctors need to run every possible test to diagnose me. Without comprehensive testing, they distrust the diagnosis or feel dismissed. In reality, some conditions can be accurately diagnosed through physical examination and patient history alone. I must constantly check for new symptoms. This behavior, known as body surveillance, stems from the belief that only they can truly monitor the progression of their supposed illness. The more I learn about the illness, the more I can help my doctors. While being informed is generally beneficial, this compulsion often leads to obsessive symptom checking and excessive online research, reinforcing the cycle of anxiety. How these beliefs form. The development of health anxiety often involves conditioned responses to bodily sensations. Over time, individuals begin to associate normal physical sensations with danger, interpreting them as signs of hidden, catastrophic illness. This learned fear response is maintained through behaviors like constant researching, reassurance seeking, and hyper-awareness of bodily changes. Treatment and interoceptive exposure. A significant challenge in treating health anxiety is that many sufferers do not perceive their problem as psychological. Mental health professionals are often sought only after all physical explanations have been ruled out. One effective therapeutic approach is interoceptive exposure, which targets the conditioned fear responses to physical sensations. Interoception refers to the awareness of internal bodily sensations. When someone with health anxiety becomes hyper-aware of these sensations, such as dizziness or chest tightness, it can trigger even greater anxiety. Through interoceptive exposure, individuals intentionally provoke these sensations in a controlled setting and learn to tolerate them without panicking. For instance, someone who fears dizziness might spin in a chair for a minute or rotate while standing for 30 seconds. Afterwards, they observe and record their bodily sensations and thoughts. This process helps disprove the belief that such sensations are dangerous and reduces the fear response over time. Getting started with exposure exercises. To begin interoceptive exposure, identify which sensations cause the most distress. Ask yourself, which sensations make me fear I have a serious illness? What signs do I associate with an impending panic attack? What symptoms do I avoid because I fear they could lead to severe consequences? Once identified, categorize the sensations by body systems, like dizziness with the neurological system, or palpitations with the cardiovascular system. Choose activities that can safely trigger these sensations. For example, to trigger palpitations, you might engage in light cardio like jumping jacks for 30 seconds. After performing the activity, document your physical response and the thoughts you experienced. With repetition, these exercises can significantly reduce your fear of body sensations and help dismantle the belief that they signal serious illness. It's important to note that these activities are safe for people without underlying medical conditions. If you have a chronic illness or other health concerns, consult your physician before beginning any exposure exercises. Additional resources and final thoughts. I cover this method in greater detail in my book, Why Am I So Anxious?, which includes an appendix with guided exercises tailored to various bodily symptoms. The book is available for pre-order at getyourpreorder.com. If you pre-order before August 16th, you'll receive a bonus guide with extra materials, including helpful charts and tables. After that date, the book can be purchased from Amazon in hardcover, ebook, or audiobook formats. For more insight into health anxiety, check out my video on the topic linked here. Thanks for watching, and I hope you continue your journey toward better understanding and managing your mental health.